Good afternoon. Thank you for joining PHCA for today's webinar, Assessing and Coordinating Behavioral Health Services for Nursing Facility Residents. I'm Wendy Johnson with the Pennsylvania Healthcare Association. PHCA offers monthly webinars to members to receive updates from department staff on regulations, learn from industry experts on current trends and practices, and to gain a better understanding of practical application tools to equip you so that you may continue to provide the highest level of quality care possible. Before we begin, I have a few housekeeping items to cover. This webinar is being recorded and will be made available on the PHCA website later today. Today's webinar is informational and not for credit. Feedback is important to us, so we'll be sending you a survey following the webinar. Please complete this survey, and if you're participating in a group setting, have each participant also complete the survey. Your feedback is important to us and to our speakers. All attendees will be in listen-only mode. However, throughout the presentation, please feel free to submit questions using your questions pane on the right hand of your screen, and our presenters will address them at the end of the presentation. Now for today's webinar. The webinar will be presented by Dr. James Schuster, Vice President, Behavioral Integration, Community Care, CMO, Medicaid and Behavioral Services, UPMC Insurance Division, and Duncan Bruce, Community Care's Behavioral Health Director of MCO Integration. The speakers will briefly review the Community HealthChoices program with a special emphasis on the role of behavioral health MCOs. In-plan and supplemental benefits will be discussed with specific attention to some services that may be beneficial to meeting the unique needs of nursing facility residents. Final portion of the program will focus on how to coordinate and collaborate care for nursing facility residents. Your learning objectives for today's webinar include an overview of the role of behavioral health managed care organizations play in the Community HealthChoices program, a review of the behavioral health services available for community care members, and lastly, an explanation of how to coordinate and collaborate with community care, the Community Care HealthChoices MCO, and nursing facilities. I'll now turn the webinar over to Dr. Schuster and Duncan.
Thank you, Wendy. We appreciate the chance to speak with you all today, and thank you all for calling in to join us. Duncan, can you go to the next slide, please?
Yep.
So the educational objectives for today are as Wendy outlined, and it's really to talk with you all about behavioral health resources that are now available to nursing home residents that were not available prior to the onset of the Community HealthChoices program, and how you all can access those services for your members, and in what way we can work together to get the members this enhanced care that's now available to them. So I know you all are well familiar with Community HealthChoices, you know, the managed care program that now pays for long-term services and supports for eligible members. And so we're, as you know, there are 3 managed care organizations that are involved with Community HealthChoices: AmeriHealth Caritas, PA Health and Wellness, and UPMC Community HealthChoices. And we're talking with you today as representatives of Community Care, which is another company that sits within UPMC. So Duncan, if you go to the next one, please. So again, we're the behavioral health services under HealthChoices are managed by behavioral health MCOs. And the model that the state of Pennsylvania used for management of behavioral health services for Medicaid members has now been in place for about 20 years, and it's really a very innovative model. We now all talk quite a bit about social determinants of health, and this model that the state used was really an attempt to allow the counties, which also manage services like aging, forensic services, children and youth services, housing services, and so on, to also manage behavioral health services for individuals in Medicaid. So essentially, each county directs to a significant degree how behavioral health services for individuals with Medicaid in that county are managed. All of the counties partner with a managed care organization, and in the Southwest zone, Allegheny County and Blair County have partnered with Community Care to manage behavioral health services for their members. So unlike the Community HealthChoices services and the Physical Health HealthChoices services, individuals don't choose a behavioral health company. Essentially, the county chooses the company that it partners with for behavioral health choices. And then anyone who lives within that county has their behavioral health services for Medicaid members managed by the company chosen by the county. So we asked for this time to talk with you all today because although there are many behavioral health services also covered through Medicare, there are many supplemental services available to Medicaid Behavioral Health Choices members that were not available to members under fee-for-service. And, you know, because these are new services for individuals in nursing homes, the use of these services are still very low. And so we really want to ask for this opportunity to talk with you all about what kinds of incremental behavioral health services are now available to nursing home residents who are covered by Medicaid, and to talk about how we as Community Care can better support you and your residents through especially through the use of these supplemental services. So again, Community Care is one of the companies that partners with counties to manage behavioral health services under the Behavioral Health Choices program. Community Care is part of the UPMC Insurance Division. It was created back in '96 to support the Behavioral Health Choices work. It's a 501c3 not-for-profit, licensed as an HMO, and we collaborate with 39 of the 67 counties in the state. So at this point, there are over about 1 million Medicaid members that Community Care supports with management of behavioral health services. Duncan, if you go to the next one, and this is just a visual of the UPMC Insurance Services Division. You can see it includes UPMC Community Health Choices as well as Community Care. So Duncan, if you go to the next one, please. These are the counties that that Community Care works in, and you can see in the Southwest zone includes Allegheny County and Blair County. So our goal for individuals in the Community Health Choices population is really to, similar to the goals that we have for all the members that we are responsible for helping with. And it's certainly to try to encourage the role that behavioral health can play in overall health and wellness. We certainly try to make sure that coordination and collaboration is simple and referrals are easy, and we want to talk a little more about that today. So Duncan, if you go to the next slide, please. And again, we really try to use a frame where the member is really the center of our work, and really all of us are really focused on serving the member. So if you think about what are some of the incremental behavioral health benefits, and so we wanted to talk a little bit about these because, again, these are benefits typically many of them are not covered by Medicare, and they're benefits that were not available to individuals in nursing homes until until the managed long-term program, supportive services program started, which also enrolled individuals in nursing homes into the Medicaid behavioral health programs, which they were not in previously. So on the next couple slides, we tried to bold a few of the services that we think are really probably novel and that were not available to nursing home residents prior to the onset of the long-term supportive services program. So one is a program called Mobile Mental Health. So this really allows mental health providers to see individuals in nursing home settings. So it's, we know that psychiatrists often see individuals in nursing homes as well, but that other providers have often not been available to see individuals in nursing home settings. And under this mobile mental health benefit, many providers are now available to actually come and see individuals in your facilities. A second service is called psychiatric rehabilitation. And this is a program, again, not covered by Medicare, but covered by the Behavioral Health HealthChoices program that focuses on helping individuals become more functional in terms of managing their own care and managing a number of their daily activities. So again, it's called psychiatric rehabilitation services. Another service that's available pretty much in all counties is called blended case management. And unlike the case management from the health plans, this is a provider-based case management service that facilitates coordination of services, helps individuals access things like housing and vocational programs, and really adds to the service spectrum available to individuals. There are also crisis services funded by Medicaid that are available to individuals. These typically include mobile mental health crisis services, as well as telephonic mental health crisis services, and often residential crisis services for individuals with behavioral health issues. There are also peer support services. These peers are individuals who have had typically a mental health challenge, him or herself, in the past, who then has gone through some certification and works with an agency, and they can see individuals in residential settings often, or certainly in other settings in communities. So this is another service that may be available to individuals in nursing homes. And then Medicaid often also pays for telepsychiatry, and this is under review by Medicare as an added benefit, but currently the Medicare benefit for telehealth services is relatively modest. And so Medicaid will pay for telepsychiatry, often for individuals when they go to a mental health center. If there's not adequate psychiatry available, there are telepsychiatry services that can supplement that. Duncan, if you go to so on the next slide here, you can see that there are also incremental benefits available to individuals for substance use treatment that are available in the Behavioral Health HealthChoices program that were not available under their prior fee-for-service benefit. So this includes often expanded access to non-hospital detoxification and rehabilitation and halfway house services. So these would be providers like Pyramid or Gateway or Greenbrier, who are not hospital services but provide services in a non-hospital setting. There are some additional community-based services like drug and alcohol intensive outpatient services that are available to individuals that weren't necessarily covered under fee-for-service. There are drug and alcohol provider-based case management services that are available. And in addition, methadone is a service that's available under the Behavioral Health HealthChoices program. So again, there are definitely some incremental services that we think might be of benefit, at least some individuals living in your facilities, like mobile mental health, peer support, and crisis services that were not always available under the fee-for-service benefit that they may have had previously. All right, so I'm now going to turn this over to Duncan, who's going to talk a little bit about some of the strategies that we've tried to develop to make services more readily accessible. But we'll talk some about those, and then we're definitely interested in hearing your all thoughts about what both may be helpful to you in terms of services as well as engagement strategies. So Duncan, I'll turn this over to you.
Sure. Thank you, Dr. Schuster. So let me just take 1 second to recap. So Dr. Schuster did briefly review some information about the Community Health Choices program and some information about community care and what are the services that are available that were not available until the recent past. So I'm just going to take a minute or two to sort of look at how all this stuff comes together, how it's managed and who manages it, and what are the different roles and folks that are part of that. So there are sort of two primary mechanisms and positions that are integral to managing the behavioral health world with the Community Health Choices world. So the first position I'm going to talk about is the behavioral health coordinator role. When the Community Health Choices program was implemented in January, all of the CHCs were required to have a behavioral health coordinator who's a behavioral health professional who resides and works in Pennsylvania. The behavioral health MCOs were also required to have a person in that role as well. So all the three CHCs will have a person who's officially designated as a behavioral health coordinator, and all of the BMCOs as well have a person in that role. For community care, I fill that role of being the behavioral health coordinator for community care. So everybody who has that role has a couple of different functions and responsibilities. So I listed a couple of them in the slide there, and some of those are actually taken directly from the information that DHS put out with the CHC implementation. So that's some of the things that we're sort of all obligated to do. I would just like to take a second and sort of talk about a few other things. I think one of the main things that all of the behavioral health coordinators do is to make sure that services are coordinated on an individual member level. So it sort of goes down to that sort of granular level, making sure that anybody that sort of comes across our desk that needs behavioral health services, we're trying to make sure that enough coordination and collaboration and referrals take place for that person to get what they need. So today we're focused on nursing facilities, but the CHC program actually covers a lot of individuals. So we, not only work with folks who need behavioral health treatment within nursing facilities, but also the sort of broader CHC population as well. A couple of other things that are important is, again, some provider education and awareness about behavioral health. So the CHC program brought in a number of folks that until recently did not have behavioral health coverage through the Health Choices program and through community care. So nursing facilities is definitely one of those groups. So we're trying to do as much as we can to make sure that folks are aware of behavioral health, the role it plays, the integral role in overall health and wellness, to also make sure our providers are aware too that there's sort of a new group of folks that may be requiring and needing behavioral health services that they typically in the past wouldn't have worked with. So we're trying to make sure that on the provider level, everybody is aware, members are aware, and that the behavioral health MCOs and the CHCs are both talking to each other and making sure we're coordinating and collaborating effectively. So, I think those are some of the key things that the behavioral health coordinator and their role is to do. So that's sort of the one piece of making sure the system is hopefully running well. The other piece is the role of the service coordinator. So all of the CHCs have to have service coordination as a administrative sort of built-in function of the program. And they have a sort of a pivotal role in making sure they coordinate Medicare, LTSS, physical health benefits, and behavioral health services that any member may need. They are the key person in putting together the person-centered planning team and all the work that goes into that, bringing all the appropriate providers, members, families, physicians all together to put together a comprehensive plan to make sure that members, not only their behavioral health, but their physical and LTSS needs are met. So they have a central role in this whole process. I know since the CHC program launched, you probably all have had numerous visits from all of the CHCs and the service coordinators to come out and do some assessment and evaluations on a lot of the members that reside in nursing facilities. So as they went through that assessment process, one of the roles that they had and one of their sort of mandates was to look at someone holistically, including what that person's behavioral health needs may be, and help to sort of facilitate and coordinate and collaborate with the behavioral health MCOs to make sure that those needs are met. So again, the behavioral health coordinator and the service coordinator, I think, are the two sort of pivotal points in roles in managing this. From the behavioral health MCO end of it, our sort of primary sort of vehicle for making sure that we are coordinating, collaborating is our care management department. So care managers do a number of different things, but one of their primary functions too is to make sure that they are coordinating and collaborating on treatment needs for our members. So any work that needs to be done on a member level usually will run through our care management department, and they will actively work with the whole team on making sure behavioral health needs are met. Let me just advance the slide here. So just to sort of recap, what is the best way to start? If you have somebody in a nursing facility that you're identifying as needing behavioral health services, so the best place to start is through the CHC service coordinator. Again, as I just sort of explained, that is one of their primary functions to pull everything together. So I just did want to add a couple of other things though. So they're the best place to start. They will contact Community Care too for any additional collaboration that's needed. I will say this though, I've listed Community Care's member and provider line. So we are always open and willing to talk to anybody. If you have any questions whatsoever about behavioral health, members can call themselves independently if they have questions about their benefits or any type of programming or services. They're more than welcome to call in. They can speak to somebody in customer service, or they can talk to a care manager directly for more information. And providers of nursing facilities, again, we definitely welcome folks calling in if there's parts of the system that you don't understand, or you need some assistance on an individual case. Happy to have that conversation with anybody that calls in. We also have a Community Care website, which actually has a fair amount of useful information on it. So it was a good place to start if you have just a general question about behavioral health and what resources are out there. But we also have a contact us option on the website. So if you wanted to communicate via that, you could, and that will typically be bumped back to me or somebody else who will follow up with you if you had a question. And last, excuse me. Lastly, I think one of the things that we hope to achieve from this sort of conversation that we're having today and going forward is to help to start to build some partnerships between us, the nursing facilities, and help you build partnerships with some of the behavioral health provider community out there, and with the counties as well. So, as Dr. Schuster mentioned, one of the primary things that we wanted to do today was to give you some information, give you some resources, but partly also to start a conversation on what your needs may be. So, to date, the behavioral health utilization in nursing facilities has been relatively low. So, there's probably a couple of reasons reasons for that, we can sort of only speculate. But I'm thinking, definitely this is a new benefit for a lot of folks. So, increasing awareness, I think, is definitely part of the equation for making sure that the behavioral health needs are met. So that's partly why we're discussing this today. We would like to, after today's webinar, follow up with everybody and try and schedule some interviews with your staff, and that could be really anybody within your facility. And part of that will be to get some thoughts on what you think are the behavioral health needs in nursing homes. Again, we are open to exploring development of new services if that's what is sort of going to be a best fit for this population. So again, to build a new service, we definitely need feedback from nursing facilities, because you work with folks on a daily basis. I think know best what the needs are going to be. So we'd like to further the conversation about what you think would be needed. So after we're done here, tomorrow we're going to be sending out a short survey. It's 6 or 7 questions. It shouldn't take more than 5 minutes to complete. And we're hoping you would all take a couple minutes to do that. Again, to give us some feedback on what you think your needs are from a behavioral health perspective for the residents that you work with. Again, actually, it's going to be going out tomorrow, and PHCA is going to be sending that out on behalf of Community Care. So I had one other thing I just wanted to quickly review and go over here. So in an effort to support the Community HealthChoices implementation and to support our behavioral health provider network, we have a series of trainings that we're doing in June. You'll see there's 2 dates. One is on June 20th in Pittsburgh, and one is on June the 26th in Altoona. This training is the same training. We're just doing it in 2 different locations, Allegheny and Blair County, which are the 2 counties in the Southwest region where Community Care is the Behavioral Health MCO. And it's a free training. And I just moved on to the next slide. You can see the different topics that are covered, and I'll sort of briefly review those. But it's opiate use disorders and medication-assisted treatment for older adults, medication considerations in older adults, assessment consideration in older adults, managing grief, loss, and related stage of life issues in older adults, and managing complex medical conditions and comorbid behavioral health diagnosis. So it's a full-day training. It is a free training. You do get CEUs for therapists and nurses as well. When we send out the survey tomorrow, I will also include a link if anybody is interested in attending the training. Again, it's easy to register. It's a free training, and we would definitely welcome anybody from nursing facilities if they would like to send their staff or attend themselves. So that's sort of the information that we wanted to cover. I don't know, Dr. Schuster, if you had any other information that you wanted to go over quickly. And I know that Wendy was going to read any questions out if there were any.
Sure. No, I think really I just wanted to reinforce the message that, with the onset of the managed long-term supportive services, individuals also gained access to the managed behavioral health choices program, which really does encompass a larger set of benefits than individuals had previously through Medicare and fee-for-service Medicaid. So we're certainly interested in offering those services to your residents, and would really appreciate your help in terms of thinking about what services they could potentially benefit from, and how we can support the residents and you all in making that happen.
Great. Thank you, gentlemen, for this information today. We really appreciate your time. At this time, we'll open up the question and answer portion. We already have some questions here that I will read momentarily. Please use the question box on the right hand of your screen if you have any questions. And right now, the 2 questions that we have are related. So how does this service help the counties other than Allegheny and Blair counties?
So the other counties have other companies that manage behavioral health services in their counties. And particularly for some of these supplemental services, the counties have some discretion in terms of which ones they offer, but generally the counties offer mostly the same set of services. So although community care is not the right contact in those counties, you could certainly contact the county behavioral health office in each individual county, and they'd be able to give you information about how to get those services in their county or connect you with the appropriate MCO for each county.
Yep. So I just pulled up the map that we displayed earlier, which shows the community care counties, and just sort of as an extra visual to, I guess, help sort of place everybody geographically where we're talking about. So for the southwest region of the Community Health Choices program, when it launched in January, it covered the southwest 14 counties. And if you look at the map I pulled up, Allegheny County is sort of in the middle. So we cover Allegheny and Blair. And again, the sort of outlying surrounding ones will be managed by different behavioral health MCOs.
But the majority of the services should be available in all the counties. So if you're in another county, I would just encourage you to contact your county behavioral health office, or if you know the behavioral health MCO for your county, to contact them, and these services should be by and large available there as well.
Terrific. Thank you for clearing that up for us.
You're welcome.
There is a question here. Sometimes when looking to determine what CHC plan a person has, it is marked on the website as behavioral health other than the other three. Do these individuals remain as primary medical assistants?
That's a good question that I don't know the answer to. If the individual who sent that question wouldn't mind reaching out to us by email afterwards, we're happy to try to drill down into those individual members with them and find out the answer to that question.
Terrific. Thank you. And I will be providing after the webinar, for everybody on the webinar, and even those who signed up but weren't able to attend, I will be sending an email either later today or tomorrow morning on, with the link to the recording, the presentation slides, as well as our presenters' contact information. So it'll all be in one place for everyone. Are there any more questions? I don't see any more questions. Let's give it another minute.
And again, we are sending out the survey that Duncan referenced as well, with support from PHCA. So we'll really appreciate if you all can take a few minutes to complete that, and then certainly are happy to follow up individually with as well.
Yeah, I would just add that obviously, we couldn't cover every single thing in a short sort of hour like this. But we were hoping that, after the fact, that when we reach out, if you're interested, we're more than happy to come out to your facility and have a sort of a more in-depth conversation and bring some additional resources. Or we're happy if you wanted to contact us and, invite us to come out too. We, definitely are willing and able to do that.
Great. That sounds like an offer everyone shouldn't be able to refuse.
Well, we'll even bring bagels if that's helpful, or cookies, whichever people prefer. Right.
That is recorded now, so.
All right.
You heard it here. All right, I'm not seeing any more questions, so we'll give everybody a couple more minutes back in your day. Again, okay. A survey is going to be emailed just on how today's webinar met your needs, if you could complete that. And tomorrow, PHCA will be sending out the community care survey along with some information on training. So look for that, and please get that completed. I know that's going to be helpful information in, just improving the lives of our residents. Thank you to Dr. Schuster and Duncan for presenting on this topic. We really appreciate it, and I hope everybody has a great remainder to your week. Thanks for attending, everybody.
Thank you.
Thank you,
Take
Wendy.
care. Bye-bye.